Good evening, I'm Jessica Bell and we are your Pfizer team.
I'm Nathan.
I'm Rebecca.
I'm Anthony.
I'm Monica.
And this evening we'd like to thank you for giving us the opportunity to discuss a social issue we find very important to the Dallas-Fort Worth area. This evening we are going to discuss our problem and our solutions to fix this problem, a schedule of events, how we're going to measure these successes, as well as the budgeting and staffing of this event. Homelessness results from a complex set of circumstances that often require people to choose between food, shelter, and other basic needs. Poverty, unemployment, lack of affordable housing, drug and alcohol abuse, family and relationship breakdowns, domestic violence, physical and sexual abuse are all factors that result in people becoming homeless. These factors also result of them staying homeless. Being homeless has hidden dangers that the expression living on the streets often overlooks. Homeless individuals don't always have a safe place to stay. Oftentimes, they sleep and stay in unsafe, unhygienic buildings, abandoned cars, or in overcrowded shelters where abuse and violence is common and not easily avoidable. Children make up 25% of the Dallas homeless population. Homeless youth experience a high rate of infectious diseases, many of which can be prevented by vaccines. Most of the homeless youth is made up of runaways. Therefore, their early departure from school and limited access to public health services make them a particularly vulnerable high-risk group. 17% of the Dallas homeless is made up of women. The #1 cause for homelessness among the women is domestic violence. Many fleeing victims often have no place to turn or the financial means necessary, much less the needs necessary to obtain health care. Ensuring access to health promotion and disease prevention is critical for all people and a fundamental principle for Dallas public health. Community collaboration is vital to meet the needs of the nearly 3,000 Dallas homeless. As a result, we are partnering with Genesis Women's Shelter and Dallas County Health and Human Services. Our objective with Healthy Jump is not only to address the physical health, but also to educate the homeless on ways to stay healthy through patient education. Our clinic will provide basic health screenings, vaccinations, hygiene products, and a general health Q&A. Together with addressing the adverse social circumstances that lead to homelessness, vaccinations are an effective way to prevent strategy that will improve the health of the homeless. Now Rebecca will jump into Healthy Starts plan and scheduling.
Hi, I'm Rebecca, and I'm going to go over the plan. For the event now that Jessica has explained the purpose of the event. Pfizer, as she said, is partnered with Genesis Women's Shelter and the Dallas County Human Health and Services to provide 2 events to benefit the homeless women and the homeless children in the community of DFW. Genesis is going to provide the location for the event and volunteers to help with the event as well. The DCHHS, which is the Dallas County Health and Human Services, has agreed to provide the medical staff. They already provide physicals and vaccines at their location, so they have the experience. Some coordination will need to take place before the event. Pfizer will need to coordinate with the DCHHS to get the vaccines ordered and be sure that we have enough for the event. Pfizer plans to order a bounce house for the event, as well as set up carnival games and create the care kits that will be handed out to each individual. A lunch will also be provided to the volunteers at the event. The best way to advertise the event will be to hang flyers throughout the city. I have provided a copy of the flyer in each of the packages that you received. Genesis Women's Shelter will also provide the event information to all of its residents. Pfizer plans to hold 2 events. The first one will be in January and the second one in July. January was chosen because it's right at the beginning of flu season, and we plan on handing out flu shots, and it'd be a great target time to hit the community and prevent them from catching the flu. The second event in July we thought would be a great way to get everybody in and out of the heat and get them inside into the air condition. Both events will both benefit the homeless and the public in general. The events are open to homeless women and children, as we said before. The Simple Clinic can help people prevent getting sick and provide them knowledge to take care of themselves. We are going to provide a question and answer session at each event, before any vaccines or anything is provided to the patients. Each participant will be provided the opportunity to receive a yearly physical, vaccines, and a care kit. And while all of this has happened, the kids will be supervised and they will be well taken care of. A bounce house along with a cotton candy machine, ring toss is an example of one of the games, and other fun carnival games will be provided. The kids will be supervised by adult volunteers from all of the sponsored companies. And next, Anthony will jump into how we plan to measure the success for each event. Thank you.
And to measure our success, there are two areas that we will need to focus on, and that will be patient satisfaction and patient health benefits. And to measure patient satisfaction, we will conduct Likert skill surveys or 1 to 5, and personal interviews. And to measure patient health benefits, we will use long-term follow-up, statistical measurements and reports, and follow-up interviews. And it is also very important that we share our success measures with our sponsors, our community, and the public, so they can understand the value that we add to the community. And this helps make future events possible. We will partner with local newspapers and local television to report on our event, and they will feature our success stories and interviews with the people that we have helped. And now, I'm passing off to Monica, who will jump into our staffing.
Obviously, to conduct such a big event, we'll need all the help we can get from our companies. So first of all, we'll be recruiting our medical health professionals, such as nurses and PAs, to conduct the medical part of the clinic from the DCHHS, since they already conduct such clinics at their offices. As for the rest of the volunteers, or those who will be helping throughout the day, such as setting up, being in charge of the carnival, watching the kids, providing lunch to everyone volunteering, and just helping out wherever it can be needed, those will be provided by both our companies of Pfizer and the Genesis Women's Shelter. As our team ourselves will be managing all the volunteers, we'll meet up earlier in the day before the clinic starts to kind of train everyone and tell who's doing what, so that it isn't a big mess and everything runs smoothly. And also, since our medical staff will be working so hard and our volunteers, we're going to provide them with a yummy compensation, aka lunch. So food is always good. To kind of focus on what we'll be providing here, some basic vaccines that we'll be providing are to help prevent the flu, any pneumococcal or streptococcus illness, such as pneumonia or like any bacterial infections, and tetanus. These vaccines are most important in preventing easily communicable diseases because in small, tight-living communities such as the shelter, they're easily transferable, especially amongst children, because children, they have germs, they run around, they don't wash their hands. Therefore, it kind of creates a cycle of illness inside the shelter, and everyone's perpetually sick in one way or another. We will also be conducting blood tests. The medical staff will be conducting these tests, such as STD and tuberculosis testing. The STD tests include measures for HIV, herpes, and syphilis. Since knowledge of using protection and general health education is low throughout the homeless community, these communicable diseases are very common throughout shelters and be proved deadly if they're not found of or treated quickly. Another good thing about these blood tests is that they result in the same day, so that both we are being effective and what we're conducting is effective as well. We will also be providing a care kit as an example we have brought. We ourselves, Pfizer, are a pharmaceutical company with a mission to provide effective and affordable health services to everyone that needs it. And so to do that, we'll be providing a care package for every woman and the children that are attending this clinic. That includes hand sanitizers, pads, condoms, general washroom necessities, or hygiene products. In the Q&A portion of our clinic, as mentioned before, we'll be educating them on how to use these products and so that they have the basic necessities and materials for proper hygiene, health, and communicable disease prevention. Now, as you all might be wondering how we're going to do all this, where do we get the money from? We have Nathan Askins telling us about the budget of our project.
All right, so our budget, this is a very general overview. I have it split between per person and the total that we'll be spending. This is for one event. Because we're gonna be doing 2 events, it's basically just the double of this. So for vaccines, it's estimated that it's about $9.50 per person, blood test, $21, the caring kit, little over $7, the carnival at $2.57, and then the food for the volunteers at $20 per person. We're going to be providing Jason's Deli for them. So that includes like their sandwich, their chips, their drink, and everything for that. So the vaccines, blood test, caring kit, and carnival are based on a 700-person turnout for this, and then the food is for 50 volunteers that we have for this. There is a more accurate and detailed description of the budget that is located in our Pfizer packet that we handed out to you. So per person, how much this is going to cost is going to be a little over $40 per person for each person that shows up. So this includes the vaccines, blood test, the caring kit that we're going to provide. So how much is all this going to cost? Is that we're estimating around $60,000 for both events. So we're asking the Dallas Chamber of Commerce to invest $30,000 to help provide care for the homelessness in the Dallas-Fort Worth area. So in conclusion, Pfizer is going to help with the community, and we believe this sets well with the Dallas idea of helping the community with health standards. So we're homeless health services and education, improvement of the community health, and providing a fun environment to the children who may not normally be able to have this kind of excitement, especially with a carnival. And this works well with the Pfizer mission statement of helping the global healthcare community, and we're doing this right here in the Dallas-Fort Worth area. All right, do you have any questions? Yes.
Towards the beginning, you had a slide that sort of broke down your percentage by gender and age sort of homelessness, but then later I think you're saying that this program is just for women and children. Is that accurate?
Yes, so I believe on that slide what we had was that it was about 3,000 people in the Dallas-Fort Worth area, and then
Is that to keep it within a certain budget, or just that's your focus?
we designed it for women and children because we were kind of trying to focus kind of more on the children's side, and we believe that mothers with like children and everything are going to be the most affected by this, and usually mothers and children will be together, especially in a certain shelter.
We also felt like there was a conflict because we are doing it at Genesis Women's Shelter, and that is a location where battered and abused women do go to. So bringing males into that situation probably isn't the ideal, or that probably is not the ideal situation.
Okay, thanks.
Any other questions?
I have one.
Yes.
So what is the benefit that Pfizer reaps from putting on this project?
So for Pfizer, what we get out of this is that we do get brand recognition because we are going to be sharing our statistics with the Dallas-Fort Worth community. We get that brand recognition. And so Pfizer is a pretty large pharmaceutical company, and so we're hoping that from this is that people will buy more Pfizer products and go to vaccines that are Pfizer.
And as stated earlier, it goes along with Pfizer's mission statement, which is to provide effective healthcare and products to those in need. So we'd actually be going along our mission statement by doing this also.
You go.
Yeah.
Okay, sorry. Is there a care pack for women and a care pack for children, or are they the same? Did your kids get the condoms?
No, like our family. It'll be our family.
Okay, one.
Or, yeah,
Okay,
or,
got it.
Yes.
Mhm.
And how does your fair differ from anything else that's going on right now?
Well, for this, is we have the carnival, and so we're trying to kind of create that X factor for these, where we're trying to include children in this as well as adults. And so we're trying to focus a lot on families, because a lot of women and everything that are out on the street and everything, they also have children that they have to take care of. And so we're kind of wanting to have them involved too, as with like the children.
Because there's normal health clinics, but no one provides like a carnival or kind of a fun day for these kids that they normally don't get.